Good morning and welcome to Metropolitan Family Health Network, our 2021 celebration of Community Health Center Week. I'm Joan Dublin, Metropolitan's President and Chief Executive Officer, and this week we celebrate community health centers, the chemistry for strong communities. Despite our challenges for the past 18 months, we have always been here providing top quality health care for more than 17,000 men, women, and children. In addition, because we knew the health and economic effects of COVID has had on the people of our community, we organized free food giveaways, made vaccines available here and within the community, and to include the churches, a vaccine drive, and a men's health center day. Thanks to the generosity of our vendors, we are distributing healthy food and more to those in need. Today and tomorrow, we will be providing meals for those who represent the homeless. I am now pleased to present our special guests, our supporters and advocates who have prepared special messages for you to help us celebrate this occasion. Thank you.
Greetings, I'm Senator Bob Menendez, the senior United States Senator from New Jersey. Welcome to National Health Center Week 2021. I would like to send my heartfelt thanks to the staff of Metropolitan Family Health Network for your hard work this past year. I strongly believe in the value of community health centers and the integral role you play in ensuring that health care is affordable and accessible. Your centers open their doors to those in need of quality care, no matter where they are from, the challenges they face, or their ability to pay. That's why during the debate over the American Rescue Plan, I fought to ensure our community health centers were not left out. Indeed, we all know that vulnerable communities at high risk of contracting COVID-19 are those that community health centers serve every day. As we take this week to recognize the integral role that community health centers play in our communities, please know that your dedication to the health and well-being of New Jerseyans in extraordinary times have not gone unnoticed. Thank you for all you do.
Hello, I'm Donald Payne Jr., Congressman for New Jersey's 10th District. I want to take time to encourage everyone to get a COVID-19 vaccination shot. It is the best way to protect your family and loved ones from future infection. I got the vaccine as soon as I could for a few reasons. As a diabetic, I have a greater risk of infection than other Americans. Second, I wanted to protect my family from infection. And third, I wanted to show all of my constituents in the 10th Congressional District that the vaccine was safe and effective. Now that I'm vaccinated, I do not have the constant worry of infection. I can go into stores and meet people safely. And I know I'm doing my part to return our state and our country to normal. So please get vaccinated and encourage all your friends and family members to do the same. Thank you.
This year's theme for National Health Week is Community Health Centers, the Chemistry for Strong Communities. And I think we need to be mindful of just how spot on and true that really is. As we endeavor to come out of the pandemic that gripped the world for more than a year, costing all of us so much, let's remember how we pulled together in our communities and weathered the storm. And our healthcare providers were crucial in that recovery. Since 2006, after Metropolitan Family Health Network opened its doors, it has continuously provided a full spectrum of stellar healthcare to our residents at its multiple locations, in fact, increasing its patient visits by nearly 350% annually. And while we battled the unforeseen of the socio and economic ravages led by COVID on communities around the globe, Metropolitan Health was there along the way by providing free COVID-19 vaccines on site and at area churches, or distributing several hundred free bags of healthy food to needy families, or even hosting a COVID vaccine drive and Men's Health Day just this past June as an example of its efforts. Happy National Health Week, and thank you, Metropolitan Health, for living up to this year's theme of being the chemistry of our strong community.
National Health Center Week, which is observed this year on August 8th through August 14th, provides all of us with this opportunity to thank our healthcare professionals for their dedication and tireless commitment to serving their patients and our communities, particularly over the past year and a half of the COVID-19 pandemic. COVID-19 has confronted all of us with the challenge of a lifetime and has impacted every aspect of our lives. Throughout it all, our healthcare workers have been on the front lines as true heroes. As treasured assets in our communities, federally qualified health centers meet the health needs of the uninsured, the underinsured, the underserved, the most vulnerable. New Jersey's 23 federally qualified health centers, with 136 licensed sites throughout the state, serve more than 500,000 people each year. Our experience collectively with COVID-19 has shown a bright spotlight on the same long-standing inequities that have contributed to health disparities affecting racial and ethnic groups in New Jersey and nationally, and that has also placed them at risk for this virus. Community health centers have been leaders and invaluable partners in providing preventive and primary care for the most vulnerable members of our communities who lack access to care otherwise. During the pandemic, community health centers have provided COVID-19 testing to individuals who otherwise may never have been tested, including going into farms to provide testing for seasonal migrant workers who come into our state every year. Now they are playing a vital role in helping to vaccinate as many individuals as possible. To date, 62 health centers across New Jersey have administered over 473,000 vaccine doses to New Jerseyans. Thank you again for all of your efforts. While this week highlights community health workers for special recognition, the work they do is highly valued and recognized and greatly appreciated every single day of the year. Thank you.
Hi, my name is Jim McGravy, and I have the pleasure to work with the New Jersey Reentry Corporation. But today is something very special. It's about celebrating National Health Center Week. You know, I stand in front of the photograph of President John Fitzgerald Kennedy, whose brother Robert had the opportunity to tour some of the most stricken poverty areas throughout this nation. And we saw the importance of providing health care. Well, today it's a great opportunity to recognize all those who work so hard in the vineyard. And particularly, I'd like to thank my dear friend Joan Dublin for what she does, not only in terms of Jersey City and Metropolitan, but what she does on a statewide level with all the federal qualified health centers. You know, we at New Jersey Reentry Corporation have the privilege of working with those individuals who are coming back from prison, coming back from jail, and coming back from addiction treatment. So many of them had not have had the benefit of quality health care. And that's why we formed the Reentry Commission and the Women's Reentry Commission. You know, when it came time to providing feminine hygiene products to women coming out of the Edna Mahan jail, there was one institution that stepped forward, perhaps more than any other. That was Metropolitan. On a personal level, I'd like to say thank you to Joan. I'd just like to say thank you to all the FQHCs for making sure that whether it's feminine hygiene supplies, basic supplies when people were coming home, it was the FQHCs. It was our churches, our synagogues, our mosques, our houses of worship who saw the need. But the FQHCs provide a premier level of health care every day. I could give you chapter and verse of stories of individuals suffering from hepatitis or HIV or diabetes, and particularly hepatitis B, which unfortunately among our population is approaching historic proportions. But it's been because of people like Dr. Beatty people like Scott Carey and the incredible team that Joan has assembled, and also working with FQHCs all across the state of New Jersey. So on this National Health Center Week, I want to say thank you to my dear friend Joan, not only what she does here locally on Garfield Avenue, but what the FQHCs do statewide. They are a treasure. And I'm also very grateful to Senate President Sweeney, Speaker Coughlin, but Governor Murphy, because they lifted the rate of reimbursement for the FQHCs. At the end of the long day, we have the privilege of serving persons who may not have had the quality of health care that they ought to have had during the course of their life. FQHCs remedy that inefficiency. They remedy that disparity. So to Dr. Beatty, to every physician, to every nurse, to every administrator, to every healthcare professional who serves the least of these, I want to say a special thank you from my heart on this National Health Center Week, celebrating what you do not only this week, but frankly every week and every day on behalf of those who need medical care, health care, among the most. Thank you and Godspeed.
Hello everyone, this is First Lady Tammy Murphy. It is my honor to join the entire Metropolitan Family Health Network in celebrating National Health Center Week. This year's theme, The Chemistry for Strong Communities, perfectly expresses the connection between access to quality health care and thriving communities. Through our maternal and infant health initiative, Nurture NJ, I have seen firsthand just how important comprehensive primary and preventive care is for New Jersey's mothers and babies. And as we work to make New Jersey the safest and most equitable place in the nation to deliver and raise a baby, we are incredibly grateful to be able to count Metropolitan Family Health Network as a trusted partner. You are making a difference in the health and well-being of New Jersey families every day. So on behalf of Governor Murphy and our entire administration, thank you and keep up the great work.
Hello everyone. I am absolutely delighted to extend warm greetings to all my friends at Metropolitan Community Health Center as we celebrate Community Health Center Week all throughout this country. The theme for this year's Community Health Center Week is The Chemistry for Strong Communities. And no organization better embodies that theme than Metropolitan. The chemistry that you bring forward to address the needs in the communities you serve is exceptional. You have been a champion for the most needy in Jersey City and Hudson County. You provide outstanding health care to thousands of people every year, many of whom would not receive any health care otherwise. You serve everyone, regardless of their ability to pay or their status. At a time when we need quality, compassionate health care, Metropolitan has stepped forward to lead in this effort. I know this last year and a half has been extremely challenging. This pandemic has been a nightmare, especially for those in the healthcare sector who have been on the front lines, taking care of people, often at their own personal risk. I want to thank the entire staff of Metropolitan, doctors, nurses, technicians, administrative staff, everyone who walks into your facility ready to offer a service, to assist, to take care of patients, for having the commitment and dedication to your job each and every day under difficult circumstances. I also want to thank your leadership, especially your board members. You know, board members have an important job, and sometimes they don't get the credit they deserve. So I want to pause and offer a special salute to all of the board members of Metropolitan. And I want to send a special thank you to my dear friend, your leader, CEO Joan Dublin. Joan is a good friend, and I appreciate so much all that she has done to lead this great organization. So let me finish by congratulating the patients who utilize Metropolitan, who have made a very smart choice. You cannot seek help from a better community health organization, and I know you know that. I wish everyone associated with Metropolitan all the very best, now and always. May God bless you and keep you all safe and healthy. Thank you. Take care.
Welcome to National Health Centers Week. I am Dr. Patrick Beatty, the CMO and the Vice President of Medical Affairs for Metropolitan Family Health Network. I'm also a person who has recovered from having COVID-19 disease. In 2020, early on, I was infected with COVID, where I was hospitalized for 4 months. I was on a ventilator for approximately 1 month and spent several months in outpatient physical and occupational therapy. At the time I became ill with COVID, there was no vaccine. So my thought to you would be, if you haven't been vaccinated, you should. There have been a lot of reasons why people don't want to get vaccinated. To a point where they think that you get a vaccine and you get the disease. Yeah. There are also many people who believe that getting the COVID vaccine will make you infertile. That's not true. And there is some suspicion about vaccines, especially in people of color, due to things that may have happened in the past. This is not the case with this vaccine. We should, by all means, protect ourselves and others and our family. And one thing that you can do to protect them is get vaccinated. And I will repeat, get vaccinated. It is important for your mental and your physical health.
Again, just to say thank you to our elected officials and community partners for contributing to this virtual presentation. I want to thank all of those who have supported Metropolitan Family Health Network, and most especially our physicians, providers and staff, members who continue to provide compassionate, quality care for the community. We look forward to the day when masks and social distancing are a distant memory. The only way that will happen is when everyone gets vaccinated. So please, if you have not been vaccinated, get vaccinated. It's safe, it's effective, it's life-saving, and it's available right here at Metropolitan Family Health Network. Thank you.